The next pandemic won't announce itself.
It will spread through a city for weeks before anyone notices.
By the time the first patient collapses, millions are already infected.
What if something was already watching, tracking every mutation, every symptom search, every irregular purchase pattern? The question isn't whether AI can predict the next outbreak.
The question is, who decides which outbreak gets prevented?
I'm Jordan. This isn't about technology saving humanity. This is about the moment surveillance becomes survival. The last pandemic killed millions, not because we didn't have medicine, because we were always 3 weeks behind the virus. Lockdowns came after the spread. Vaccines came after the mutations. Warnings came after the deaths. Reactive systems don't save lives, they count them. The cost was $14 trillion, 20 million lives, and a question humanity can't ignore anymore. Can we see it coming next time? The system is already running. AI models scan millions of data points every second. Hospital admission patterns, pharmacy purchases, search engine queries for symptoms, social media posts about feeling sick. In certain regions, algorithms detected unusual respiratory cases 9 days before official reports. 9 days. That's the difference between containment and catastrophe. Machine learning doesn't just track disease, it predicts mutation. By analyzing genomic sequences from thousands of samples, AI identifies which variants will dominate before they spread. The technology exists, the infrastructure is being built, the surveillance is expanding. But here's what they don't tell you. AI learns from the past. Every prediction is based on patterns that already happened. It can detect known mutations, known transmission patterns, known symptoms. What it cannot predict is the truly novel threat, the pathogen with no historical precedent, the zoonotic jump no model anticipated, the synthetic creation no dataset includes. The system is only as good as the data it receives. Wealthy nations have sensors everywhere. Rural regions have almost none. The outbreak that starts in an unmonitored village reaches monitored cities only after it's too late. Predictive systems create an illusion of control until something unpredictable happens. But there's a deeper problem. Prevention requires surveillance. To predict an outbreak, the system must monitor everyone. Your location, your purchases, your health data, your movements. Total health security requires total information access. So ask yourself this. If AI can predict who will get sick, can it also predict who won't get treatment? If it knows where outbreaks will emerge, does it also decide which communities get protected first? The technology doesn't make these choices. The people controlling it do, and they already have. When prevention becomes possible, the question shifts. It's no longer can we stop it, it becomes will we stop it for everyone. History shows us what happens when life-saving technology isn't distributed equally.
Vaccines sat in warehouses while people died waiting. Treatments existed but never reached certain borders.
Predictive AI does not solve inequality. It optimizes it.
The future of public health isn't just about preventing outbreaks. It's about who gets prevented from dying.
The next pandemic is already gestating somewhere. AI might see it coming, but will it warn everyone or just those who can afford the subscription? The question isn't whether we can predict the future. It's whether we can predict who survives it. I'm Jordan. If you want to see the future not as it's promised, but as it's being coded, subscribe.